All surgery, wherever it's carried out, comes with some risk and things can go wrong. If they do and a patient dies, the case may be referred to a coroner who can issue an official warning. Spire Healthcare has received 3 warnings in the past 2 years. Over the same time period, other private providers have received none. This is a coroner's report known as a Prevention of Future Deaths report. It's issued when someone has died, and the coroner says that action needs to be taken in order to prevent it from happening again. So this report outlines how a woman underwent a routine hernia operation at a Spire hospital. The hospital were late diagnosing her with sepsis, and the woman later died. Now here it says that the failings at Spire Hospital contributed more than minimally to the death. This death was avoidable. The report from last year highlighted the role of the resident medical officer, or RMO. They're like NHS junior doctors, but in private hospitals, they're sometimes the only doctor on duty overnight. Here it says the RMO was called twice during the night, but failed to appreciate that the deterioration in her condition necessitated an escalation to the surgeon or anaesthetist. David Rowland runs a health think tank and is critical of the NHS using private providers. He's worried about how they're staffed, particularly out of hours.
What we've seen in a number of instances where something's gone wrong in a private hospital after an operation and the consultant has left the hospital, the anaesthetist has left the hospital, the responsibility for dealing with that emergency lies with the resident medical officer.
Since 2009, the NHS has said doctors shouldn't work on average more than 48 hours a week. In some private hospitals, including Spire, RMOs, now called resident doctors, are contracted to work up to 168 hours a week.
So 9 to 5 normal day shift, and then they'll be on call from 5 o'clock in the evening to 9 o'clock the following morning before working again the following day shift for the entire 7-day period. And at that night part of the shift, you might be called once, not at all, or you might be up the whole night looking after ill patients.
It seems to be absurd that an NHS patient can be protected by those patient safety regulations in the NHS if they have treatment in the NHS, but an NHS-funded patient who is treated in the private hospital sector can be treated by a doctor who is working such very long hours.
Panorama's been given the testimony of 28 resident doctors working at Spire up until 2022. Most had been recruited from Nigeria and came to Spire to start their medical careers in the UK. Almost all of them were worried about their workload and the potential safety implications for patients. To protect their anonymity, actors are reading their words.
I was made to work under very difficult situations, working long hours.
I worked in isolation, mostly unsupervised and unsupported.
I was working round the clock, being the only doctor at night, feeling constantly burnt out. And this is obviously not safe for the patients, nor for me as a doctor.
On several occasions, I couldn't sleep for at least 2 hours for consecutive nights.
I constantly had concern about patient safety in the Spire Hospital.
Spire Healthcare says the well-being of all its staff is of paramount importance and has since updated its working practices. It says it has robust safeguards to ensure that resident doctors are well supported and are only working when adequately rested.